Hello, everyone. Today we're going to work on ACL. This is the Andrew Nowitzki. He's a heavyweight boxer, and I believe he's going to be a world champion. You'll see it. So, what's happened with Andrew? He was go for the run. He's go for the run, and he running in those Echo Park.
Yeah, in Griffith Park.
Griffin Park. And guess what? All those roots everywhere, those uh, whatever, those uneven surface. And what's happened to him? He's step and spread his ankle. And that ankle spread, the ankle is go all the way up to the knee because we have that valgus leg, which is the Andrew. You have this collapsing ankle in front, and this has triggered that knee. And of course, he went to that fight. No, where did you fight?
I have a fight in May of Boston.
Uh,
May, Boston.
no, like where that happened? Remember you showed me the
It's
picture?
happened in Griffith Observatory when I'm running uphill.
Yeah.
Look,
So when he went to the boxing match, he tried. He finished with a big hook, and his leg kind of slide off, and he get that ACL turn.
Yeah,
So
it's happened twice. Twice it's happened in my last fight in,
Yeah.
in Boston. Yeah.
so he came up here. We did some work, and I just tell him you need to do MRI. Every time you need to do MRI because he feel this discomfort constantly. You know that fear. He's gonna slap again, and is gonna create that pain. So he went to MRI. It shows the ACL was ripped off on like fully, right?
Full
Full,
report,
and
and two meniscus.
two meniscus and the lateral collateral ligament was also half ripped, so it's like a 50% left. So he decided to do surgery, and this has been 4 months. And as you can see, I'm gonna put the camera, but the person who did the surgery did really good work. Actually, I don't see like big scars.
It's a very good man. He's
Tell his name. Tell
yeah,
his
he's
name.
Steve Mora, who did this surgery. He's working with a lot of sportsmen, UFC sportsmen, big names, guys in UFC.
Okay, so
Steve
if you guys experience that ACL problem, knee problem, find that guy and go for the treatment. So the problem is here. We don't need to work actually on knee a lot. We work more on the ankle because they remember that ankle problem. So we want to find that stability in that ankle. So he gonna feel that stable. We also work a little bit on that on the knee surrounding muscle. Just make sure it's in good condition. So what we're doing first, we go ahead, lay down, face up. Face up. It's like I said, it's not a lot of stuff to do here, but you can see he get this duck leg. You see this rotated out. So what we're doing here, we're gonna work on that rotation on that hip. We can also check his ankle. I usually, like I said, check the ankle and see. This one is, as you can see on the camera, it's not rotated and really good outside. So it's no internal internal rotation or what's it called, eversion, right? Eversion of the foot, not a lot. So he said he feel good, he feel much better. Jumping is still problem. Like I believe it's on that mind control level. So what I tell him, we need to support that knee and try to jump, of course, lightly, and keep working as a physical therapy. So we're gonna show a couple exercise here, not exercise the strengthening, but idea is work on that ankle. So not the ankle, ankle and foot. So what I'm doing here, as usual, I'm working on that ankle. He just mentioned he got the spasm on this side, and actually this is our key too, because so he's not shifting weights on this leg. He's not doing so. He's shifting everything on this leg, and legs start cramping in this area in the quadriceps, and I can feel that right in here where the attachment is, that quadriceps muscle. It's very like I can feel it. Also, I want to check that level of the hip, and yes, this one is higher, so that's mean he's lean on that weight on that leg all the time. So what we need to do, we need to work on that PSOS muscle, release that PSOS. Iliacus muscle, work on the quadriceps here, create this mobility in this hip, get that pulling sensation. What's the call? Decompress, also work on that rotation. Do we work on that scars? I don't think we need to work on the scars. I do have a tool like that gua sha or scraping tool. Sometimes I do scrape, but I think we need to support that knee. So, and the scar is not looking bad at all. So it's like I said, the guy did really good work. So let's work on that hip first because he's complaining on that one. So what we're doing first, we're gonna create that little bit mobility of the hip. So we're gonna bring this up as usual, grab it, hold it, and rotate it. I do see it's not a lot of limitation there. So how's it feel? So yeah, he said it's a spasming, and he's waking up. And that's what area? It's right in here.
Right here and all of the leg.
All over the leg. So it's like I said, he's probably using that leg a lot. Compensation, yes, because the shifting weight. What we do, I use this nice muscle relaxation, and this is also analgesic, like get that pain away. And it's polarized CBD, arnica, and mint. It's a good stuff. It's called Ilia. You can find this online if they still produce, because some company very close, very fast, open and close right away. So this is gonna give you like little freezing sensation. What I'm doing here, I see a lot of people go fast. I don't want to go fast. What I want to do, I just want to go slowly. And here I use my whole body weight. So I let that adapt. His brain, his muscle, everything adapts. So I go very slow. And work on that knee. David, you want to add something too?
Yes, there's the ankle. The ankle is so critical.
You can go ahead, grab that microphone in that box. Also, I can work with my forearm. How's it feel right there? And I feel that big, kick that flower here, big like a trigger point. That's the point we want to work on. And that's maybe what's that cause. If we look at that trigger point map and that ligaments pain, it's exactly where that spot is and where's the pain is transferred. Here we go, David, so go ahead.
Well, when people have issues with their knees, you're going to always look below and above. So there's always going to be issues of some kind with the ankle, maybe the foot, and then the hip. Something can be thrown off on the back. And so you have to look at external rotation, internal rotation. Are your hips level? Do you have good dorsiflexion and plantar flexion of the ankle? You have to look to see why if he did not have some kind of an imbalance somewhere in his ankle and his hip, he might have avoided it. His body would have adjusted maybe during that fight. We don't know for sure. But in order to get everything firing naturally and normally, you got to make sure that there's enough stability and strength in the soft tissue, and also it has the mobility that it needs, and it has to be excellent in both of those things. So he's looking and remedying each of the problems one at a time. So that's how you have to address it, and it's very clear. You can see all the little weaknesses in there.
So, and what I'm doing right now, you're not gonna see it a lot. I'm gonna get this arm under this leg and rotate it. So you remember that dog legs is pointing out. So my arm is coming inside, grab the whole leg and another one on the top, and I rotate it in. I rotate it medially and ask him to rotate. Rotate out. Go ahead, rotate. Выкручивай назад. And he's turning back, and I'm relax, let it go. And I do this again, and I rotate, and I kind of lift it a little bit up.
Stop.
So working on that hip. So you see that the problem is up here because the compensation. And let's see if this is one. Yeah, right there. Whew, this is really strong, and that's the smells is coming to my eye, and I'm like, whew.
Right.
Yeah, it's really
Strong.
good stuff. It's a good stuff for the athletes, guys. All those biofreeze, it's good, but this is more ingredients in here, like polarized CBD, so
An analgesic.
analgesic, yeah, which is the biofreeze do the same, but like I said, it's more ingredients, it's more natural stuff in here. And I believe that Tony Hawk, that skateboard guy, he's advertised this product. So, like I said, it was 3 years ago. I'm still buying that stuff. It's still available, but I'm not sure if the company still exists. Like we used to do Quanta, and it's not there anymore. So, how's it feel?
Yeah, perfect.
It feel good. So it's like I said, it's simple. Everyone can do this. The idea is get that muscle a little bit away from the spasm. And this is our mission right now. Do we want to stretch this? No, we don't want to stretch. Because this is he puts all weight on that. We don't want to make it weak. When you stretch it, you make it weaker, right?
To the point.
So now we're going to band this and get this attachment of this biceps femoris muscle, all this quads muscle, and working on that area, right on that. Yeah, I can feel it. Doing okay up there?
Yeah.
Look, I'm just moving that knee in and out. I'm asking him to activate this muscle, push against me, towards me. Good. And let it go. Do I want to work on that knee muscle surrounding? Not really. Maybe work a little bit on the hamstring and the back when he's laid down. Like I said, I'm going to be more work on that ankle and create that strength in that knee and give this brain idea he can jump and change directions, because this is what's the limitation right now, to go change direction quick, which is for the boxing is really important, right? When you step to the side and change positioning, that's need to be work on. How's it feel? Okay, someone sent mixed messages already. Good. So you see, I'm just like I said, it just could be what I'm doing here very gently. I don't apply too much pressure. Even for the guy like Andrew, he's a pretty big guy. Strong, pure muscle everywhere. Yeah. Right there. And we're also going to show this very closely how we do the Psoas and work on this abdominal area. A lot of people, the therapists, don't work on abdominal area. It's a big, big mistake. Okay, go ahead, push again. Let it go. Can you, David, give me that band? The lower one. The purple. No, even stronger, because he's a strong guy, so we need to give him a strong one.
Yeah, this is good.
Yeah. Okay, so we work on it. Thank you. We work on it now. We want to strengthening this and see how that feel. So what I'm usually do, he got this I'm gonna get this around, the big band is, and go close, not on the skin, on the shorts, go around, and I want them to work. So get around me. You see I pull this way and around my butt. So lift it up, and I want you to start moving up and down, just like that. So what I'm doing, here we go. And I lean. So he's working on it. Tell me, what do you feel? Yeah, of course. Yeah, that's what we're going to do with that knee too. With that knee, with the injured one, with surgery one, we try to make him get some stability. Good. Next one, you can do bring it up like this, and he's moving here and outside. Remember, we're working on that duck leg, so we want to get that muscle active. And remember, he got that spasm in his front and his back in the glute. And like I said, everyone get different approach. You can, and let it go. How's it feel? It feel good, he said. Great, because you start, like I said, working on it. Now mobility, get that mobility. Like I said, you see I'm holding that under the knee like this. Right here. My other arm is covered on the top. I can lean. The table is a little bit high for me, but that's fine. So I'm leaning on that knee.
Want me to lower it?
No, I can lower it. It's right in here. So I can work. That's why the technique is important. We need that high. I keep it high because I know we're going to sit down and do some. And here we go. I lean and I rotate. Everything have to be nice and smooth. Don't rush yourself. You know, athletes come in and you guys start do sport massage. You do quick, fast. No, just let them feel. Let them feel everything. Gluteus medius is going to be effective? Of course. Yes, they are. Let's finish this side. And let it go. Now I'm going to work on that PSOIS. Let me get this camera closer.
ASIS?
Yeah, PSOIS. Here we go. So I found that navel and hip bone, and it's right in the middle, right in here. So I'm gently, without any angles, without vertical, horizontal, I do vertical. So I place my hands on his belly, on that area, and all what he's doing, I bring this knee up and start asking him to breathe. Deep breathing. When he's breathe out, I'll go a little bit more. You're gonna feel that one for sure. And here we go. Wow, this is very spasming. This is like a rock. It's like a wall. You're like, and that's it. Yeah. You doing okay up there? Sometimes people said, oh, I feel that it's shooting down your leg, shooting down the testicles. The guys feel this in the testicles. Right there, you feel that?
Yeah, a little bit.
Yeah. So this is take time. This was probably like a 15 minutes just working on this area because he start training again and we need to, there we go, right there. So why I'm doing this, because remember this muscle could be contracted, loaded, so we need to help this muscle. Also work on that fascia around. And just work in general for the belly. Always work on your client belly. And look at this side. You feel that more on this one?
No.
You feel on the left. Yeah, that's what I'm asking all the time. Where do you feel more? And he said, yes, I do feel on the left side. Massaging this. Ah, right there. Take that spasm away. Pain?
More, yeah, pain more.
Okay, so he feel pain. I'm a little bit, because I feel that I reach that area. If you're not sure you're on that same muscle, just do this. Bring it to 120 and extend, and you will feel it pops up right after your under your fingers, after your whatever you use. Even knuckle, I can use the knuckle up here because he gets those big muscles. But I'm gently, don't push too hard, and I use my body weight. You see, I lean to my body. People like sometimes doing this, they use the whole force in the arm. No, use your body weight all the time. You want to work more deeper, give him this, give him that short bend, which is right in here, You can apply one to one leg and another to another leg. Here we go. And what he's doing now, he's pulling this leg. No. Pull it up like this. So what he's doing, he's activated, right? Here we go, very slow, and go deeper. And you work on that now, watch. You see what you're doing? Get that action slowly, This ball, we need to use this too soon. Here we go, what do you feel? Right there, big pop. It just pop, a little twist and pop. And he said it's getting better. It's less tension. Let it go. Don't don't torture your clients. Like, and the problem is, like, if he's an athlete, yes, he knows he need that band. But regular clients come in and you start using those bands, they just usually like say, "Oh, can we not do those bands?" Try to explain to them, this is muscle activation. You need to do those bands exercise, and you need to do this on your own. And most people don't do anything. They just like, oh, I don't have time. Well, it's very sad when you don't have time for your own body. Right there. And what I want to do, I want decompress. So pull that hip out. What I'm doing here, usually this is heavy leg, so I'm probably gonna do my way. I step on the side, get this leg between my legs like this, lock it in, and what I'm doing, grab that whole leg and pull. You see what I'm doing? I pull with my body. I'm lean back. I push in and lean back. Push in and lean back. When you push in, you can do also rotation. You're probably going to see on this camera. Pull out. Now I ask him to resist me and pull towards the ear. Here we go. Very good. And relax. And I pull more. Again, pull and relax, and I pull my way. Decompress. Pull one more time and relax. Good. Come back to this, work on that quads a little bit. You don't need to work on the skin. You just basically hold that muscle and make him like let it go, relax. So the brain is going to send a signal to let it go. So you're just holding it. Get that spasm away. And it's actually better. I still feel that big spot right in here. I usually take big thumb, find that spot, place my thumb on that spot and cover with my other arm and push it down. And I'm just holding and moving in all different directions, deep friction. Very light, don't go fast. How's it feel? Always communicate with your client. He feel nice, so it's good. And as you can see, no oil. I don't use a lot of oil, and Okay, still that duck leg. Dog leg also great, and it's actually good for this knee. We're gonna get that band right here, and then this one, and ask him to do wipers. So do wipers, like this. So stretch and very slow. What he's doing now, activate those muscles. You see, he's pulling out, like open it up. That gluteus muscle is also work. If that gluteus muscles in a very like problematic area, it's going to spasming right away with this exercise because it's directly targeting gluteus medius right now. So much stuff around. So you see he's also work on that knee already, work on that ankle. But before we're going to jump on that problematic area, on that injury area, I'm going to work a little bit on that glutes. And the best way to lay on the side. So lay down on this side up. Разверни, другую сторону. Here we go. Don't forget your phone. So, here we go. Look at that. The glutes is open up here. Here we go. Look at this. You see? He can actually work on the neck. He can push that ball against that floor, against the table, and reactivate those side muscles. So, right in here, it's going to be always sensitive. So, I very gently, here we go. And I do find that spot. You see, and this is the spot he's bothering him because the legs rotated outside. He's put too much pressure on it. This is the definitely muscle need to be trained. We don't need to stretch that. People stretching it. So we need to work on that. Right there? Yeah. He said exactly. Look, and sometimes this problematic area shooting to your lower back. And people come in and say, oh, my lower back is in a problem. I'm sent them to MRI. They come back. MRI, nothing shows up. We touch that area, and it comes up right away. Right there. You see how I'll go very gently, so. Let's get this camera a little bit away. So I'm going to ask him to do this. Move. I can do it for him. I can do this with the band again, but he can do it. Here we go. Do you feel more? Yeah. Yeah, because he's in action right now. Always give your client action to do. Not just like let him be like that. There we go. Do you feel that pop? 3 pops. Pop, pop, pop. Right away. So he's mobilizing it. Open that hip and I work on that muscle. Here we go. Another pop. Wow, unbelievable. Some people use elbow. I don't think elbow is going to be very sensitive. Even for Andrew, okay, you're going to use for some older folks, they're going to jump out from the table. Only if they pay you extra for some torching style massage, yeah. This is the one, trust me. Let it go. He's tired a little bit. And all that stuff. Remember, we can do some action here. We can bring the band up here. He can start raise the band. Just raise this leg up and down like this. Here we go. He's in action? Yes, look at that. This is what we do every morning in Zaratka class to strengthening those muscles, to activate. You see? Here we go. Yeah, he's struggling. You see? Here we go. Let it go. So this is what here we go. Big pop. You feel that? Something popping right there. And that's I think it's a part of that now. It's a TFL, tension fascia latte. This is the part right in here. And remember, yeah, and that's what he said. When I'm touching it here, he feel all the way down now. Yeah, here we go. So this is the one. Foam rollers and exercise. A lot of standing and get that leg to the side, lay down on the floor. That's going to be the exercise for him. Right there. Yeah, those turn ligaments Rico. That's the no joke. No joke. And David is going to do visual today because remember, sometimes the damage on the legs, it's also can be blocking in your visual. So he's going to clear this out too. It's a lot of neurotraining right now comes up in the sports, and the athletes do some amazing results, like a crazy results. Getting better?
Yeah.
He's getting better. Yeah, now I can use my forearm just holding it up here and move around. Like I said, I'm not a big fan of apply too much pressure or elbow work. Do I want to stretch this area? No, I don't want to stretch this area. Okay, and now what we're going to do, we're going to roll back face up. Face up again. I'm going to work on that ankle. Remember, we have to work on that ankle because the ankle is trouble. And as usual, I grab that heel and start mobilize it. Here we go. It's already pop. Now I need to roll that table back. Working on that dorsiflexion, get that joint between your tibia and talus. It's no space up there, it's not moving well, so we need to move that one because he needs to jump. That power have to come from these movements. And what I see is valgus leg, which is he got this foot pronation because this bone is start growing. That big toe bone is start growing. So he put too much pressure on it. We need to correct it. Open this up. A little decompress gently. Remember the knee being surgery. It's been 4 months now. And oh, okay. So he redo MRI, just see how's everything healed, which is smart. We need to be always sure what's going on. Even if you go physical therapy or to doctor, you need to know what's going on up there. How's that heal? But like I said, he's already doing good. Only the problem is explosion jumping. So we need to kind of work on that. Okay, same thing, working on that, the duck leg. I'm going to show you from this side so you see it. I scoop that arm all the way, rotate, you see the top hand rotated, and I ask him to rotate back. So rotate outside, наружу выворачиваю ее. Very gently and relax, and I'm just doing this. Above the knee, and below the knee too. Come up here, grab that, and gently. You see I'm gently, I know, and rotate back, and let it go. I can also spray with this lubricant because it's go inside and it feels very good. Yeah, I give it to you. It's all yours. I bought 300 of those.
Ти заказав?
Yeah, I bought, and people love it. Work around knee again. Rotate. Working on that tibialis muscle. Get this pain.
No.
Feels good. Yes.
Уже хоть чувствительность потихоньку восстанавливается ткани, понял? Раньше я дотрагивался, не чувствовал.
Yeah, there was a lot of dystrophy in the leg because he didn't use it a lot. So now he said it's coming back. That sensitivity and the strength is coming back, which is yes, you have to do the strength. We can do another way. We can do this way. Here we go. No. Just one. And he started moving. You see that foot? So he activated, and I'm working on that tibialis muscle just like that. I can put around the knee. Here we go. See, he's activated this. He's moving. I can go different way here too. Pull up and work. Look at that. Yeah. That shin muscle. Here we go. All the way down. See, he's good. He's really good. I like it. And this is what I want to do in this position. Now we're going to ask him to flip down, face down. That way. Oh, hold on. Before you flip, I'm going to show you the great exercise for muscle activation. Go lay down up again. Ball. You get that ball right on that foot and ask him to squeeze and push down. Yes, you see he's reactivated that hip. And actually I'm going to give him to the opposite side. Yes. Just like that. He's squeezing it. You see how he's activate his hip? Let's give him to opposite side and see what's he's gonna feel up here. You right away. You see, his pops up right away. So I can work on it. He can push. Let it go. No, don't push yet. So relax. I'm gonna find out exactly where is that. You see all different. There we go. Wow. Yeah, I do found it now, very deep. Push it down now. He's activated. Push. You feel that more now?
More.
Yeah, you do feel more. And relax. Right there. Ooh. Yeah, I did it. Just you see, this is action. Activate everything. And it pops up right away, right under my fingers. And that's something, yeah. I think that magnus muscle is also affected. Those abductors muscle, I can feel it. Yeah, we can do adduct. Can do that. Right there. And it's okay if you find something later. Sometimes it's happened to me. You change your strategy, and it's absolutely fine. Right there. So I would say I will give him exercise for this adduction, abduction with the bands exercise. Squeeze the ball between the legs. That's going to be the exercise to make that muscle stronger. Right there. Yeah, that's exactly all those attachments.
Как будто хочется, хрустнуло.
Хрустнуло.
И попустило. Да нет, да, настолько защемление.
Это мышцы просто. It's not a nerve. Nerve it's start pinching constantly. You feel this. It's just a muscle. Because compensation, yeah. Always do rehab. If you sprain your ankle, if you did something, if you step on the nail, you start shifting weights to the opposite leg because you're not walking normally, and you start limping. And if you don't do any rehab, what's going to happen, you're going to start shifting that weight, and it's going to be trouble for your hips, for your lower back, for everything. So everything starts with our foot. It's like your balancing your tires. If you don't balance your tire, you're always gonna go left or right. Your steering wheel is gonna pointing out, and that's gonna be the problem. Right there. Okay. Mm-hmm. So we need to give him homework to do those ball squeezing and bands. Oh, okay. So he said it's right there. Let me give him bands. Give you this leg, and what we're gonna ask him, it's to raise this leg up, only one, and down, just like that. And I get to that spot and ask him what he feel. Do you feel it? Yeah. You get the idea. And yeah, be careful with this area, the pubic area. Right there, you feel it? Yeah, he got it right there. Yeah, here we go. So what we found, when I'm touched that spot, he become weak. So he can't even lift it up leg like, you see? Right there. Okay. So if you put too much pressure on that side, on that muscle, so do we need to stretch that? No, we need to strengthening that. We need to do this exercise with the bands. And that's what he have to do it. Right there? Yeah. Okay, yeah. You feel it. Up and down. So we helping that other leg is get that rehabilitation time, because like I said, he's compensated. You see, I'm helping him out. He's getting stronger. Yes, he get a little bit quicker, and that's the idea. Go ahead and hold. Try to hold, and I can resist him. You see, come on, hold. Yeah, you need to definitely work on that. Very good. Bands, it's a revolution for the training. Right there. You see how we activate with the bands and the squish ball? That was a big time. Up and down. I know. He said you can lift it. Let him. Can you, David, pass me that the ball? If he can lift it up, let him push down. Push down and relax. Don't push too hard. Like 20% of the strength. Some people like try to push so hard, the full strength. Very light. Don't need to. There we go, and relax. So we don't want him to. He's trained enough. And relax. Let it go. Very good. Push down and let it go. So this is what we can do. Now you're gonna flip face down. Face down. We're gonna work on that. You can leave it, but here we go. So this is also, I'm gonna work on that hamstring, on that bad knee. So put that ball up here and lift it up. Ankle too. So, but I'm start with this knee. I think your microphone, David, is still on you, and I can hear your noise. You know what I mean? Okay. All right, so here we go. I found that area, right in that hamstring with that knee, and I start slowly drop, and my finger kind of glide to the side. You feel that one? Yeah, he do, because that's usually the scar. You can feel that scars right here. This is how they do up the surgery. It's always scar up here, and it's very easy to reach from here to push it down. That side scars. Right there. So what I'm doing, I'm just drop that leg and my fingers is going to the side, just like that, gliding them down. Also, you can work on that ankle. Watch. You can create that dorsiflexion, which is not a lot up here. You can move, you can mobilize that ankle. Look at that. Let me work on that hamstring a little bit more, on that scar area. And I work on the whole hamstring. And remember, this glutes, the whole leg is weaker, so what we can do, we can reactivate the glutes. How to check? Squeeze the glute, squeeze. Butt сожми, relax. Now this one, you see how strong, the left one is very strong, the right one is not because he's been weak. So what we need to do, we need to just activate those glutes muscles. You can do with the bands, you can do with the manual therapist, he can do this. I'll show it to you. We call that ride treatment. Pushing around. And we're gonna upgrade Andrew today with our vision exercise. So he's gonna be like those Terminator. Actually, what's your nickname? Rampage. Here we go, Rampage. Working on that ankle, that fascia bags surrounding. What I'm doing here, rotate ankle away, and my arm is coming this way. So it's kind of like a chicken dance. I'm doing this. So I'm working on that fascia bag. Do I rotate it fast? No, because I'm remember the knee is still problem, and you see he's guarding. So I'm just giving like idea. I'm working only on the ankles. Because sometimes people do this big range of motion, and it's get this little bit knee rotation, which is good. Where you have to go? Ну, у тебя через полчаса будет. Хорошо. Okay, working on the hamstring, working on the glutes. My favorite, working on the glutes. Get that knuckles, working on that glutes. Activate the glutes, beat them up, you see? Help to the left too. Great. Next one, working on that hamstring muscle activation. Give this band and ask him to hold it or place on another leg and ask him to pull towards the butt. Just like that. Just like that. There we go. Work it up. You can hold it. You can put this on this opposite leg, or I have the hook up there, and you can definitely work on that hamstring. You see what I'm doing here? Working, and it pops up right away. Always in action. This is the physio massage. Always do in action. Here we go, big pop. And look how, yeah, he's struggling right here. You feel that hamstring? Oof. That's hamstring is very loaded. I can feel it. Oh, wow. We definitely need to see. I need to work on that. He's just second time in our clinic. He came before the surgery. Now he got surgery, and we definitely have to work that way. Okay. My favorite one, squeeze the ball. Get this ball right in here, and he squeezed that. You see, he can do bigger ball. You can ask him to, yeah, right here. Squeeze that ball. You can work on that glutes. What is it, spasm? You see, right away. No. This is, we get them action, the muscle gets spasm right away. So muscle is weak. Do we need to stretch that hamstring muscle? No, and that's what the problem is. A lot of people start stretching because they feel it's a weak. Bridge exercise is going to be great for it. Like I said, band pulling, get that hamstring strong. We need that hamstring for that knee support, for that stability of this knee. We don't want that wobbling anymore. Working on that hamstring. Ask to push that ball down. Place that ball, push down. You see, he's trying to squeeze, reactivate that. He's working on that quads muscle now because he's do this flexion and extension now. You see that pops up right away in here. You can work on that sacrum. Sometimes this sacrum problem, you can do this here. Great. And let it go. Okay, we're gonna go sit down. Go ahead, sit down. And I'm gonna show you a little work for those knee. So I usually lift them up really high. And this is the great exercise to do. It's a correction. So usually it's a 10 pounds and you get 10 pounds or 15 pounds. And what I'm doing, I'm gonna get to this, he's already know, he's gonna squeeze. And all he does, he let it go and don't need to lift. It's just hanging up here. Just like that, like very small motion. Make sure it's, yes, it's movable, moving everything. And you can also get that patella and work around this area. I don't need to even, like I said, he's like hanging up here. Feels good?
Yeah.
It feels good. So he's just bouncing. Also, yeah, he can start lift it up. He can do the band, which is right in here, and he started lift it up. Yeah, now he's lifting up. You see, I'm holding that band. You can attach to the table, to the chair. This is great exercise for that knee. This is the beginning stuff. My favorite one, he also work on that hamstring. Remember, the hamstring is being spasming when he starts to smash the ball. I give him this ball. Put it right on that table. He places on the top and he starts squeezing. He's pushing down. He squeezed that ball. Squeeze, squeeze, yes. Also, you can do standing, push the knee against the wall. We're going to show this in the next video. So it's going to be part 2, I believe. You have to go, right? Okay. So he's squeezing that. Great. And let it go. Okay. So next one, it's instability of this ankle. What I'm doing, we're gonna switch to that area. Okay, the idea is get that ankle is not collapsing in. And my favorite exercise, we usually give the band. So he's gonna step inside that foot. Remember, he's collapsing. He got this pronation. So the bad knee inside. He's already know. And this way. Turn this way. Here we go. No. Let's place this on the foot. Hold on. On the foot. Here we go. So it's on the foot. He's gonna step outside. Usually with a surgery like that, we give him the stick. So he's gonna hold that stick, and you just start lifting this leg up. So he's gonna standing. Here we go. You see how he struggled to get up? Why? Just lift it and hold it. Lift and hold. There we go. So what he's doing here, he's holding it. You see how his ankle is starting moving. Here we go. Look at that. Let me get this more. And what you can do, you can give him another band and start give him some weights. You see it's already attached here. You can give it to him and he can, there we go, push it forward. Like forward. Yeah, here we go. He's working on it. Good. And I can distract. Here we go. You see, that's what I'm stay always here. So if something, you just support. Okay. Let it go. Give yourself a little break. What we're doing now, we're gonna add the knee band. So I'll let it go this one for now. So it's gonna be double band. It's gonna be double. Get this. This one first around the knee. You can go below the knee first, below, and that's step inside again, and get that stretch again. Don't forget your stick. Always hold the stick. So you see what he's doing now? It's double distraction. It's below knee. Good. Just right there. Try to stand up in one leg. There we go. Look at that. How you start moving. All this start, and I'm always here. I let him know, because if the people gets, like I said, it's a fear factor. So you just right here. It's nothing gonna happen. So this is exercise. Here we go. Yes. And like I said, yeah, he can start leaning forward. You see that's, yeah, very, no, careful. You see, it's not there yet. But yes, leaning forward. Easy. You can do the foam roller. All right. There we go. Yeah, you see he's supported. Yeah, he can touch something like a bowl in front. Go ahead, watch. Step back. This one is stay where you are. You see, yeah, always here. So step back and sit like this. So I'm gonna give him that support for the knee. Always stuck here. Here we go. So go, this one is down. This one is stay where you are. Right there. Here we go. A little bit back. So it's like, right here. So it's distance. Here we go. So what he's doing here now, he's, yeah, moving this thing out. So move that knee. Try to not collapsing forward. Like right in here. And I want you to stuck. You see this, and move in and out very gently. Yes. And remember, we don't have enough space in here, so it's not dorsiflex and plantar flex. Now go ahead, get up slowly. And get this band around the ankle forward, like this. Here we go. Now turn this way, face turn this way. And I want you to start doing this. Like this, slowly forward and backward. The other knee. That's perfect. And let it go. Now turn around. Yeah, you can do this way. Yeah, this is another exercise. This one have to be lower. This one is teaching him to step over. So you step on this, is distracted. You have to step other leg around, and here we go. Touch with your heels and up. Here we go. And you can see how he's collapsing. If he gets straight, his hip is working. So good. Like I said, I have to be there, support him. Yeah, what do you feel? You feel good. You see, this knee is doing really good. He's gonna shave that. We're gonna support with a kinetic tape, and he can start do a little bit jumping. He's probably ready for that. and let it go. Now you can turn face this direction, and all you do, start lift that heel up and down, like you, here we go, push down, and make sure exactly, you see how he struggled? I can help him, hold on, watch me. I can help you to not make that most stabilize, which I apply the band, and here we go. Is that better now? Yeah. Exactly. You see, I'm stabilize it. So many different directions, bands pulling, and that's brain try to fight that and try to reactivate everything and stabilize. It's going to be great for this knee. Like I said, and of course, you're going to get apply more and more and more and more. Great. Okay, let's release that one. Let's release everything. And I'm going to show you the last for home. Yeah, release this one too. This one is for jumping. So usually people step inside the band. So you can do this way around your shoulders on microphone. And what you do, you pull. You see, this is distraction, and you start doing pulling yourself. You can do one leg, which is going to be hard. This one is weak. This one is strong, or both. And after, he can even start jumping. But that's going to help. Okay, here we go. I think I lost something. It's not supposed to go around your... Just, yeah, sit down, around. Here we go. Perfect. On the shoulders. Yeah, not on the neck. Don't do on the neck. You're going to choke yourself. And here we go. Pulling. Here we go. Look at that. Don't do a single, okay? Just both for now, because it's... And see how he doing that. And if I can do, I can just do in this. I can distract him. I can push him from this side. I can push him here. You see? There we go. Don't need to go crazy. And this is only 25 pounds bands. You can do 50. Look at that. Great. And if this ankle start collapsing, you get the band and start pulling out. So this is the one. Don't let it go. Good work. Exactly. See how you feel. Walk a little bit. You feel good. And what we can do, like I said, is for you. You can spray this all the time. You're welcome. Spray, you can cover with the plastic. What I'm doing at night, spray, cover with the plastic, that foot cover, and it should be good. You're welcome. We'll see you next week.